Well, good afternoon and welcome to the Small Business Briefing. It is Monday, September 13th, and this briefing is brought to you by Marana Group. Marana Group is a data documents and distribution services company in Kalamazoo, Michigan, not Portage, Kalamazoo, Michigan, and we appreciate their underwriting of this program. I'm Rob Fowler. I'm the CEO of SBAM, and Brian Calley, the president of SBAM, is this is a little bit of a throwback. Brian, you're back in the car. For those who've been watching this briefing from the beginning, you did the first several months of briefings from your car. You're back in it. Are you back at the gas station by the interstate?
No, I happen to be in Southeast Michigan today. An organization that I'm on the board of is having a strategic planning retreat, but just setting aside to do coming out to do the briefing and back in the car. Although it is, honestly, it's a different car than before. The previous one is now in the hands of my son, who is 17. So may that car rest in peace. And so now I've got a new to me car that I'm coming from. But yeah, it's kind of familiar. It's hard to imagine, come those early days in the pandemic and thinking really at that time, because so much was happening by video and I didn't have cable access at my house way out in the country. It was 8 to 10 hours a day in my car in the parking lot in the gas station by the freeway. So yeah, kind of a throwback, different location, different car, but still reminiscent.
It is that. Oh, all right. So we got a lot to cover today. It is while it's Monday and we've taken to looking at the data on Monday. We'll get back to data, but something obviously really important is up, and we need to talk about it. It is the Biden administration's employer mandate, and while it's a broad sweeping mandate for vaccinations for federal employees and others, obviously the one that impacts us most is the employer version of this. And let me just start with, where do you think this comes from? I mean, it sort of seemed like there was a sort of a need for the Biden administration to do something, and this one was one of the options. What's your sense of where this is coming from?
Yeah, it was a little bit of a surprise because we were seeing vaccination rates rise generally, albeit slower than certainly in the spring, but rising throughout the summer, including here in Michigan, but also across the country, especially in the South. You saw the rates that were rising. So why the mandate, that proposal? Now, it's not, the rules haven't been drafted. We're going to talk about all the unknowns, and there are tons of unknowns. But when you see something like this, it does beg the question, where is this coming from? Why now to say we're going to do a public or a private sector employer mandate over 100 employees to get vaccinated or require weekly testing? You're going to have the federal government, except for some reason, they accept the United States Postal Service from this requirement. And then also, a recommendation for large entertainment venues to require proof of vaccination, and then also a paid time off or a family medical leave benefit for those getting the vaccine. So those are the main elements. So why now, especially when you've seen vaccination rates generally picking up over time? Part of it you've already touched on, which is we've got to do something. So there was a lot of criticism in the previous administration that, hey, we've got these waves and it shouldn't happen. And if the president had better leadership, we wouldn't have these waves. That's not how this virus works. It's not up to the president whether or not we have waves, but there was this, I think there was growing pressure on the Biden administration to act differently and perform differently and better than the administration that they were criticizing. Now, so part of it is just to do something. What can you do? Which lever can we pull? And they chose to pull that lever. But I think there's another factor at play here too. And there aren't that many people that have access to influence and have a conversation with the White House. But if you look at the companies that did, the big multinational companies that did their own employer mandates, they really kind of had a problem. Everybody's having a hard time staffing up right now. And I'll just give as a simple example that's easier for everybody to know or have a lot of experience with. So Disney said all Disney employees have to be vaccinated. Now that would be one thing in a labor market where there's plentiful labor everywhere. But when Disney decided to do that, but their competitors, other amusement parks in Orlando and elsewhere, didn't follow suit, then they're already having a hard time staffing up, and therefore we're vulnerable and likely losing employees to their competitors. So the idea that there were large employers that had moved forward with a mandate asking for this to be more broadly applied across the board, I think is very feasible. This sort of thing happens, when I was in the executive office at the state, it wasn't unusual for entities, whether they be public or private sector, to say, hey, you've got this goal, administration, here's something I'm doing that matches your goal. Don't you want to make this wider? And so it creates kind of a bubble, and it kind of seems like that's the mainstream. And so, but when they did this, the employers that kind of moved in isolation toward mandates, I think, found themselves in kind of a predicament where they were not as attractive to some of the workforce, and were exacerbating the problem that they're already having in terms of staffing up. But of course, this is creating quite a stir out there, ton of uncertainty, a lot of unanswered questions. And so we want to acknowledge those questions today, kind of to run through some of the main points that need to be clarified and some of the main problems that we see occurring. But it probably also, our members understand that we do oppose mandates, not just this one. I mean, we think employers ought to be in charge of how they operate, the conditions that they hire under, who they hire and fire, that the government shouldn't have a part in that. Long-standing tradition of that is no exception here. So our policy would be to oppose this and other mandates that dictate the terms of employment. But given that it's on the table, we really need to dissect it and get to the bottom of where the main problems are going to be.
Yeah. Well, let's talk about that. I mean, sort of procedurally, the president has asked OSHA, this Federal Department of Occupational Safety and Health Administration, to come up with a set of rules. And truth is, they've been working on this for some time. They actually had a draft, pulled it back, ended up doing a set of recommendations rather than a more heavy-handed mandate. As we understand it, this mandate would be either be vaccinated or be tested once a week. But when do you think we'll see a text of the rules, and kind of what comes next?
Yeah, this is the million-dollar question. How long will it take? Based on what we've seen so far out of OSHA, I wouldn't expect it to be right around the corner. Now, maybe they've done the work ahead of time and it'll come sooner than I think, but past performance is often a predictor of future behavior. And so when the president came to office, he said, we're going to have federal workplace safety rules. And that they were on again, then they were off, and then there's all these rumors, they're going back and forth, are they going to issue them? And then 5 months later, they did finally publish, but they published recommendations, not rules. So there was, between when the president said OSHA is going to do this and when they actually came out with something, not only was it 5 months in between, but what they came out with was significantly different than what was described earlier on. And so that tells me that it's going to, and then we're going to talk about a lot of the decisions that have to make to implement something like this, and you'll get a sense for how much more difficult this is than what they perhaps appreciate. So I wouldn't expect it to be right around the corner for those that are in that, you're either a contractor of the federal government, you're in a healthcare business, or you have more than 100 employees. There's not a lot you can do to prepare now because there's way too many open questions. Maybe you could do some work in trying to understand, what overall, or maybe you already know, get a sense for, is this a big deal or not a big deal for you, or most of your workforce already vaccinated, so it's kind of a non-issue, or is that not the case, in which case how this rolls out or gets implemented might have massive ramifications on your business. So maybe understanding that your own playing field or understanding your own situation would be a good place to start. But Unfortunately, there are so many unanswered questions that operationally, there's not that much you can do at the moment.
So one of the things that that the president said in sort of announcing this was that there would be fines up to $14,000 per occurrence. That's a heavy hand, but I think it begs the question about enforcement. And does OSHA, the federal OSHA, even through its states who have a state level OSHA, have the capacity to enforce at this level?
So there's two issues here. There's capacity and will. And I don't see either one of them being substantial in terms of pulling this off. So it's one thing for the president to make a statement and issue a press release. It's another thing to have rules drafted that are going to have to answer a bunch of questions we're going to talk about today. And then the hardest step is actual implementation, because the federal government's OSHA has never been of the size to enforce such a broad sweeping requirement, if at least as it pertains to actual on the ground enforcement. Some states like Michigan have their own OSHA departments, but even out of our state, you might notice that the governor has not embraced this either. Governor Whitmer has not embraced this mandate, and so I'm not surprised by that, because there are so many potential issues, pitfalls, problems with something like this. And it's kind of handing something over to MIOSHA that they have nowhere near the type of staff that would be required in order to actually enforce on this. So I do think that from an enforcement standpoint, the federal government nor state governments are in a position to do it robustly, that they would have to mainly rely on the honor system. However, they put out there that up to a $14,000 fine, and so they would naturally catch some people. They would naturally make examples out of some, but enforcing across the board, you'll see some states that outright refuse, and other states like Michigan that are really kind of slow walking a reaction to this, because there are so many questions. And frankly, for those of us who have worked directly in government, we know that this could turn out, at the end of the day, they may end up watering it down or pulling it back so much that doing the front end work or taking on water or controversy or argument over something that they haven't even demonstrated the ability, let alone the will, to carry out. I think that's why you see states either outright opposing in the beginning, or if they're not inclined to oppose it straight away, slow walking the reaction, not just implementation, but just slow walking the reaction. We really aren't seeing out of the president's own party, we're not seeing many statements of support. I haven't seen any statements of support out of Michigan or congressional delegation, governor's office. It really looks like that across the board, they don't really want to have any, at least at this point, they don't want to own this proposal.
Yeah, we're hearing some states, mostly Republican states, outright saying we're going to sue the federal government, or we're going to take a constitutional challenge to this. Just quickly, do you have any sense of? I mean, this really does test the limits of federal versus state public policy.
It really does, and there are some there are certain facets I think are very vulnerable to challenge, and other facets where they probably could they could probably win in court in terms of mandates. So if you're talking about conditions of employment for federal workers, that's where the president's mandate is on the firmest legal grounds. So they're having rules for federal workers. The president and the federal system, they're the ones who decide the rules for federal workers. So that's where they're on stronger grounds. However, they do have a vulnerability there, and that is there are exceptions for medical reasons and religious reasons to not get a vaccine. And what we've already seen out of Kalamazoo, where 4 soccer players on the women's soccer team at Western Michigan University challenged the school for not allowing for exceptions for the students that had religious objections to the vaccine. Those students got a stay in federal court, and stays are only issued when the judge determines that they're likely to win. So if the federal government on that ground, if they don't have, even on their own employees, if they don't have a robust enough exception system, they could be vulnerable. Where I think they're most vulnerable, though, is on the requirement to set the employers for over 100 employees, private sector employees with over 100 employees, to require them to have vaccination as a condition of employment. I don't know where I don't know every single line of federal law for sure. I don't know where they get that authority from. And I think they're extremely vulnerable on the private sector side of this. Also, to say that employers must provide paid time off or family medical leave benefit to employees who are getting the vaccine, that's another area where I think they're on shaky ground. To just add that, I mean, we have a system for making laws, and so when the federal government takes executive action, they have to be able to point to an existing law in order to do that. In the general duty obligation within OSHA laws, I think that's shaky ground to do that when you have safe and effective vaccines that are available for anybody who wants them, especially those that are at risk, which of course, the older you are, the more risk you have with the coronavirus. So there's going to be plenty of legal action, but here's the catch. It's hard to take legal action against a standard that has not even been reduced to writing yet.
Right.
So some states, I think, might try to do some kind of a preliminary injunction or something, but in terms of private sector employers challenging this, I think that they have to wait until the standard actually comes out.
All right, let's talk about that. There's so many questions this begs. I'll ask you some of them, knowing that you probably don't know the answers yet, but just, what's your sense? I mean, so let's begin with what it essentially says is get a vaccine or be tested weekly. And so let's assume a very large number of employees who are reluctant to take the vaccine choose testing weekly option. Who pays for that? A home test is $25, and if you're going through the healthcare system weekly, is that an insurance claim, or who pays for it?
This is one of the biggest unanswered questions in terms of the implementation side of the equation. That when you put a requirement out there, so you're saying to somebody, as a condition of your employment, you must do this, and it's coming from the federal government, but it's in the healthcare system. It would stand to reason that they're planning on somehow covering it, but they have not said anything really about how that would work. Because you have high income people and low income people, and the idea that employees are just going to have to cover the cost, I'm afraid that seems unrealistic to me. I'm afraid they're going to say, well, employers have to cover the cost. For many employers, that's unrealistic. And then, and so maybe they'll say there'll be a reimbursement or a tax credit or something for it. But the fact that they came out with saying that this is going to be a requirement without answering questions about at least the policy on the front of saying, hey, federal government's going to cover the cost of this, let alone whether or not it's doable, do we even have the capacity for it? But federal government's going to cover the costs and then work out the details later. We don't even really know that yet.
Yeah, and again, it begs questions even about the capacity. I mean, let's just stay in Michigan, the capacity to do that level of testing. I think about, as I drive into work in the morning, Sparrow Hospital in Lansing has a drive-up testing facility for weeks. There's been a line first thing in the morning, people, getting in that line. I think they start at 7. There is no chance you're at work at 8 o'clock if you get in that line at 7 o'clock. And so now the question is, does the employer have to give time off to do the testing?
Another big unanswered question. Well, two big unanswered questions inherent in that discussion. First is it even possible to test this many more people? The ramp up required, the expense. So there's who's going to pay for it. Then do you have, and it's so you got like long lines before you have any kind of mandate in place today. And then, but then there's also tests require physical things, right? Remember, there was a time when those little Q-tip things they stick up your nose. There was a shortage of those. I mean, there's several aspects where the supply chain could be severely restricted in order to pull this off. It might not even be possible to do this level of testing. And then if you if you're able to pull off this level of testing, then what is the, when it comes to the family medical leave or time off, they've said to get the vaccine, you have to provide paid time off. Is that also required for testing? Because, I know they have some, well, the ones that you buy at the local drugstore or pharmacy, the over-the-counter ones, those are not in, those are in short supply. But then there's, but if you've got to wait in one of these lines, like these drive-through places that are out there, before a mandate even goes into effect, people are waiting for 1 to 2 hours in line. So do you have to pay the employees while they're getting tested, since it's a requirement of the job? Those are more practical challenges that face a policy like this. So even though you have an off ramp and you say, well, you don't necessarily have to have a vaccine, you can submit to weekly testing. They would have a lot of capacity, and I mean a lot of capacity work to do, because like today people are getting tested because they have a symptom. What you'd be saying now is that people with no symptoms would be tested regularly, not just tested regularly, but every single week. And you could see how that could really put a strain on the system. And who is at the healthcare system? Who's the most strained system out there? What's the most strained system out there today in COVID-19, in this COVID-19 period? Healthcare system. So there are a lot of, you can see just all these things kind of coming to a head where it's just tons of problems and challenges.
So, and it begs a bunch of questions on the employer side. I mean, how do you enforce this at the employer level? Do you ask for proof of vaccination? Do you have to keep records? Does this violate HIPAA standards? It raises a bunch of questions on the employer's responsibility side of the equation as well.
Yeah. So on the employer side, I mean, so the questions that they're going to have to answer in their rules are, is it the honor system? Your employee says, hey, I'm vaccinated. Now the employer is done. Does the employer have to see a vaccination card? Do they have to keep a record of the vaccination card? Do they have to get verification that it's an authentic card? What about if there's a booster shot that comes up here in the future, or do they have to go back and follow up, and did they get the appropriate booster? So those questions are part of it. But then also think about like the process of terminating employment. So does an employer have to then do they have to issue a warning? All they think you would document, I mean, an employee, before you fire somebody, you document all the things that happened to lead up to the point where the person was terminated. So in this case, is it kind of just a simple question? Somebody doesn't get weekly testing or a vaccination, therefore they're fired. Do you have to give them warnings? What type of documentation and protection does the employer have? What if there are union agreements that are in place? It's one thing if it's an at-will employee, but if there's a union agreement in place, are they supposing that this would override the union agreement? So now these are we're not even through a small portion of the questions, Rob, and you get a sense for how many different aspects there are and how much more difficult this will be for the department to administer rules, at least if they plan to have rules that actually answer questions so that it can be implemented. I think it's going to be nearly impossible for them to do.
Well, obviously, we have questions. We know our members are going to have questions, and we're not the only ones involved in this. We're going to stay on top of this issue as it plays out. And I'm with you. I think there might even be a scenario where it's something way less than a mandate, and we're gonna find out as we go. I want to get to another topic. The question of natural immunity, or those who've had the disease and have the antigens, largely has been ignored in this whole conversation about vaccine mandates. And a local hospital, it was one of the very first to have a mandate for vaccinations for their employees, has made an interesting change of policy, and I think it's worth watching. It may be a precedent for others.
Yeah, and another wrinkle for the vaccine mandate as well. So Spectrum Hospital, one of the first hospitals to say that employees must be vaccinated, have changed their policy to say if you can provide an antigen test that you have natural antibodies. And they cited more and more research, by the way, that I had cited on this briefing the week before, which is that it turns out that natural antibodies from having COVID-19 before are highly effective, maybe even more effective. And I know that, like, for whatever reason, this is like controversial, but this is good news, that there's that infections carry robust protection against future infections. And it is generally how the immune system works. But the fact that the hospital changed their policy, now that was happening at the same time that the Biden administration was announcing a new policy, but that's, I think, another another factor that's out there is, will this federal mandate allow for that as an alternative? And this, I think, carries a lot of legal weight, because they'll have to rely on some sort of emergency powers in order to justify their legal authority to do this. And so to say the vaccine is the only way to protect from yourself and others in the workplace. But if the science is saying that natural antibodies carry a comparable level of protection, then the use of that legal authority is very questionable, to say it has to be this and not that. And so I think this is just another place where there's could be a challenge. You'll see, we see this first example of an employer saying an antigen test is an alternative to a vaccine. I think that this will be an important policy question, but I also think it's an important legal question that the feds are going to have to answer in their own policy.
Well, it's been interesting to watch. Just if you just pick the healthcare system, some have required vaccination of their employees and others have not. And if there is a place where, you already mentioned it, where the labor force is tight, it's healthcare. And I suspect they're pushing back, they're pulling back a little bit from their original position because they are going to lose some employees if they hold to it so firmly. So interesting to watch. Hey, let's take a quick look at the data. It is Monday, and we've checked in on it just because we have a really unusual peak or non-peak going on right now, and it's worth spending a few minutes on.
Yeah, so let's just let me just pull up the slides for today, and I'll go through them pretty quickly here. But unfortunately, we do see what was a plateau before. It looked like it maybe was dropping in Michigan, maybe not so much. But looking at the country as a whole, the numbers have hit a peak and are dropping, and that's representative of what's happening in the South. You see this where it dropped really sharply down and then kind of back up and resumed a more normal looking curve. That's the Labor Day impact. So testing was way down on Labor Day. If you look at hospitalizations nationwide, kind of crested now and is at that peak. But what you see happening, of course, our country is really big, and in totally different things are happening in different regions of the country. So this week, Tennessee is the state that's highlighted here that had come up high, but is now coming back down pretty sharply. But in the South, you see clearly crested and is coming back down. That's driving the national numbers. You see out in West, it didn't go up as high, coming back down. But in the Northeast and the Midwest, you see, you do see those that are have resumed upward trends, just slightly. But before it looked like they were going down right around Labor Day, and now look like they're heading back up. So I think that's something here in Michigan, kind of the same type of thing. Now, reporting is not daily in Michigan anymore, so It makes the data kind of choppy. If you see this light pink in the background, those are the actual reports of cases, but they're multiple days together. This line down here is the average. So you'll see that it dropped down Labor Day and kind of resumed up at what could still be a crest. But if I look at the actual 3-day-a-week reportings, there's a clear upward trend. So that, you know, it looked like it was coming down. Now it looks like it's going back up again. It kind of makes sense. It's just the way that seasonal sicknesses work in Michigan in the fall. Everybody's back in school. And so you see that happening. Hospitalizations, again, it looked like it was cresting. Now it's an upward trend, still pretty low compared to a lot of other places. Certainly low compared to our 3 peaks that we've had in Michigan. A lot of states are just getting their 3rd peak now. Michigan has had 3. Just to look around a few places in the country, in Ohio, their numbers still going, their numbers have gone up more sharply than Michigan's has. And so that was a little bit of a surprise. Michigan and Ohio in the past have moved pretty similarly. But again, Michigan had a spring wave that Ohio didn't have. And so that natural immunity in our population has probably something to do with the difference in our waves that we're experiencing now. Hospitalizations look the same as their infection curve in Ohio. Looking at Florida, clearly Florida is going back down now. You see that they had that Labor Day impact as well, where it dropped way down and resumed a more normal looking curve. But clearly they're going down. We see their the number of tests. This gives me confidence that Florida's really going down. Look at their tests. Labor Day went way down. They're back up, but even though the tests are way up, the results are still going down. See that? So so Florida's definitely on the downward trend now. You see it in hospitalizations as well. So this lags a little bit. So hospitalizations going down. Looking at the UK, you know, they've had this false peak before, went down and then went back up. Kind of looks like that's happening here again. But because their over 50 population is so highly vaccinated, you'll see that the deaths that they're experiencing in this wave look radically different than in the past. And then I wanted to look at our neighbors to the south and to the north. So in Mexico, their curve looks just like what's happening in the south, and even though they're only about 30% vaccinated. And in Canada, their curve looks just like Michigan's. So you know, I think this is just really strong, and they have higher vaccination rates, obviously much higher than Mexico and more similar to Michigan. But but in Canada, in Mexico, I think it's just strong evidence of what climate has to do in terms of, or weather, I should say, what weather has to do with the way that this virus moves. And weather affects how people behave, and people behaving in certain ways creates an environment where the virus can spread more or less easily. So looking at our neighbors to the north and to the south and how well they match what's happening in the south of the United States and then in the north of the United States, I think is very telling that that this has a, we can talk about it in the future and all the ramifications of this, but it's kind of getting into that, instead of a pandemic, an endemic phase where it's more of a seasonal annual thing. And but we'll have to see how that plays out.
All right, thanks for the insight with the data. That's what we have for you today. I do want to take a minute to encourage you. We have a survey that's out right now for our members. It came out on Friday. This is really how we get insight to how our members are navigating this pandemic and other things that are happening in our economy. So we just really want to encourage you. We're going to put the link to that survey in the chat, and it's also coming out in our newsletter today and follow up midweek. So please, if you can, take a minute to fill out that survey. If you're a business owner, that's helps us be the voice of small business. So thank you. Thanks for joining us, and we'll be back here on Thursday at 3 o'clock. See you then.
See you on Thursday, everybody.